Hey everyone, it's Mary Dwasey, CEO and founder of Mary D Wellness, your virtual midwife and overall wellness coach for busy moms. So today we're going to be talking about feeding premature babies. So premature babies require specialized care to ensure they receive adaptive or adequate nutrition for healthy growth and development. Babies who are born before 37 weeks of pregnancy or gestation often have immature digestive systems and may face challenges whilst feeding. So, here is an overview of some of the key considerations and methods for feeding premature babies. So, if you go into the neonatal unit and you see these, don't be alarmed or surprised. We're here to learn. So, the types of nutrition: breast milk is the best nutrition for preterm. It's a normal nutrition for preterm babies, as it contains essential nutrients, antibodies, growth factors, and every premature infant can have fortified breast milk and to meet their needs. Also, donor milk, if a mother's milk is unavailable, pasteurized donor human milk is a good alternative. Preterm formula, specially designed formulas for preterm babies, can be used if breast milk or donor milk is not an option. And then looking at the methods of feeding, we have something called parenteral nutrition, which is IV, normally used in the early days for extremely premature babies when the digestive system is not yet ready for milk feeding. There's also something called gavage feeding, also known as tube feeding. Tube is used to deliver the milk directly to the stomach, and this method is common to babies who cannot coordinate sucking, swallowing, and breathing. Bottle or breastfeeding, also, when the baby is developmentally ready, they can transition to breastfeeding or bottle feeding. So, lactation consultants often help mothers with this process. And we do have, as you know, specialist teams on the neonatal unit to be able to support you. Nutritional fortification: premature babies often require additional calories, proteins, and minerals such as calcium and phosphorus. So, this may be provided through the human milk fortifiers, also known as HMF, which is added to breast milk, or specialized preterm formulas for babies who are not exclusively breastfed. Some of the feeding challenges that you may encounter for premature babies face challenges such as immature sac swallow reflex, which is usually developed around 32 to 34 weeks of gestation. Digestive issues, including intolerance to feedings or gastroesophageal reflux. Um, Also, slow growth, requires careful monitoring of weight gain and nutritional intake as well. It's important to be inclusive, be involved in the provision of care, monitoring adjustments as well. So regularly monitoring the baby's growth parameters, which can be, the baby's weight, length, head circumference, and then also adjusting feeding plans based on the baby's tolerance and developmental progress. Supporting parents is really, really important. So parents should receive support and education about the importance of breast milk and how to pump and store it. Also, looking at the signs of feeding readiness or feeding cues, such as rooting or sucking, and then also proper techniques for breastfeeding or bottle feeding or having responsive bottle feeding, relationship building, closeness as well. So it's important to know when to consult a specialist. As you may be aware, premature babies with feeding difficulties may benefit from consultations with neonatologists or baby doctors, lactation consultants, or individuals that specializes in, babies feeding, breastfeeding, bottle feeding, formula milk. Speech and occupational therapists who specialize in feeding as well. So, if you have any specific questions regarding premature babies, don't hesitate to ask the team who are providing the care for your baby. Also, if you have any questions for me specifically in regards to, relationship building, feeding support, please go to www.speakwithmeryd.com. Have a blessed day. Listen, it's November. We're almost to the end of the month. It's Prematurity Awareness Month globally. So we are raising awareness. Come, like the channel, subscribe, and make sure that your notification button is on. So every time that I go live, you see it. All right, have a blessed day. Bye.